MRI machines are generally quite safe. The way that MRI machines work is they use a strong magnetic force to get images of the anatomy of your brain. For your MRI appointment, you can wear your street clothes into the scanner. We just ask that all metal is taken off prior to getting into the MRI scanner. We'll ask you to empty all pockets, take off belts. You don't necessarily need to wear anything special to the MRI appointment, just something that you're comfortable with. And if you can, try to minimize the amount of metal that you're wearing. That is good, but also we do have hospital gowns, disposable hospital scrubs if there's any problem with what you're wearing. So the length of your MRI will depend on the type of MRI you're getting. A lot of the MRIs that we do here at the Penn Memory Center take around 45 to 50 minutes. It will depend on the study that you're in, so you can ask the coordinator and they should have a better estimate, but typically our scans last around 45 to 50 minutes. MRI machines are quite noisy. We do give you earplugs before you go into the scanner, and we can sometimes put music on or put a relaxing video on a screen that's behind you that you can watch. So typically during the MRI, we ask that you move as little as possible. There are times between our sequences of our scans where you can adjust if you need to, and when the scanner isn't actively taking pictures. But typically we do ask that you stay as still as possible just because it makes our images as easily readable. If there's any point that you feel uncomfortable during the MRI, we are always able to stop the MRI scan. This is completely voluntary, and if at any point you're feeling uncomfortable, that's okay. There's also an emergency squeeze ball that you'll always have by your side, so if there's any sort of emergency ever, you can always squeeze that ball. It'll set off an alarm, and we will be notified. The scans that we do here, we don't necessarily release the results, but if there's ever a concern or anything, a doctor would let you know, and you would follow up with a primary care physician. If you have any questions after your MRI, you should contact the study coordinator that's on the study that you're enrolled in. They will be able to answer a lot of your questions, and if they're not able to, they can put you in contact with anyone who will be able to.